adults will be eligible beginning April 7th. That will open up to group 5, which includes everybody else. So again, throughout this process, each time we move into a new group, we're still focused on that group plus the previous groups. So now we're in the first part of group 4, but we still are open for group 1, group 2, and group 3. Group 1 is healthcare workers, group 2, those 65 and over, and group 3 are frontline essential workers. I do want to mention one thing, and I'll just go back as we look at some of these numbers. So again, and this is something I mentioned today at the commissioners meeting, we're seeing a slowdown in the number of cases, and I think it's a proof that the vaccine, that the vaccine is working. So you see that almost 80,000 individuals are at least partially vaccinated. So they have some immunity built up from at least that first dose of Moderna and Pfizer. So then when you look at, we have 33,000 cases that we've had so far. So we also know that for every case that's confirmed of COVID-19, you have at least 3 individuals that have had COVID-19, but either didn't have symptoms, they weren't tested, so they didn't know. So you have that number that's been vaccinated, roughly 80,000, and then you add the 30,000 confirmed cases, so that's 120,000. Well, then you take the number of confirmed cases times 3, that's another over 100,000. So you have a considerable amount of the population that has some immunity. I do see, though, going forward, we still have to be careful with following our 3 W's, wearing our mask, washing our hands, keeping the distance. Making obviously we're trying to turn that dimmer switch. We're trying to turn the lights back on. It's not an on-off switch, but still being careful over the coming months as we move into holidays and events where we meet together with family and friends, such as Easter, spring break, Memorial Day. Still got to be careful, but I think we're seeing we're going in the positive direction. There is some concern that we may see a little bit of an uptick, but I don't believe, based on the number of people that have gotten the vaccine and the number of people that have some immunity from having COVID, that we'll see anything like we saw in December.